All right, we can go ahead and get started. I'll just start with a brief introduction. I'm Justin Lodge. I'm the new physical therapist they just hired on with Wright State Physicians. I've been here a whopping, 2.5 months-ish. Originally from the area, was raised in Chillicothe, about an hour from here. Came to undergrad, Wright State, majored exercise science, and then went to University of Dayton, which I know that's kind of you're crossing paths with UD and Wright State, but it was a good experience. We moved down to Tampa, Florida, which I was working down there for 3 years, so I've had about 3 years experience in the actual field of orthopedics. Decided to move back up here. Recently, we found out that we are having a baby, so the grandparents, well, my parents, the future son's grandparents, said that I better come back up to Florida or back home from Florida. There'll be some problems. So found a great job here with Wright State Physicians, and I haven't looked back. It's been amazing. I love every minute of it here. Other than that, I just want to start out with a brief disclaimer. This is a generalized exercise talk. This is not to diagnose, cure, prevent, or treat any of problems that you have. I don't really know specifically individually. This is a generalized talk for general progression of exercises. Before we start any type of exercise program, make sure you've talked with your doctor first. He knows your problems, ailments, concerns better than I do. Again, this is just a generalized talk for exercise performance and progression. This book was pretty much my Bible throughout undergrad. It's ACSM Guidelines for Exercise Prescription and Testing. It's not something you can get it online. You can look it up now. You don't have to go spend the $40 that I had to spend back in the day, but you can go through there online and look it up. If you have any questions, you can direct it towards that book as well after we leave here today. General benefits of exercise. There's two major purposes. There's preventative, to whereas we're going to expect throughout our normal lives, if we keep up a general exercise routine, that we're going to ameliorate, which means decrease the effects of the aging process. Improving our flexibility and our strength. They actually reduce the incidence of falls, improve our muscular strength, increase our bone density. There's also a therapeutic point to it, whereas recovering from post-op surgeries, orthopedic surgeries. Has anyone had any knee replacements, shoulder replacements, anything like that in the house? So you guys know what physical therapy is all about on that end. Also, people recovering with strokes, arthritis, fractures, they actually regain function based on through physical therapy. Benefits. I think everyone knows the improvement of cardiovascular health, not only increasing cardiac output, their overall cardiovascular fitness, improving the cholesterol profile. We're getting lowering of the bad cholesterol and raising of the good cholesterols, and also our blood pressure control, lowering of our blood pressure. Respiratory capacity and function, increasing that. Bone strength, muscle strength, increasing. Basically with resistance exercises, aerobic exercises, things of that nature, you're going to be increasing both of those, improving our flexibility and our coordination. And also, when we exercise, we feel good about ourselves. We feel better. We feel more alive about everything. And it's good to socialize, too. You get out there, you get in your exercise groups, your morning daily walks, things like that. It's definitely good for to meet people and have fun. Again, these are a lot of some formulas that I don't expect anyone to even know or try to figure out, but there's a lot that goes into, it's actually work. It's moving our bodies through space against gravity, essentially what it is. You see our little guy running up the hill there. Again, like I said in the beginning an exercise program, consult with your physician, who will then send you probably to a therapist to be evaluated for more of a orthopedic strengthening program. You need to reevaluate and evaluate the patient's needs and goals. What do you want to accomplish? What things are you unable to do? What things would you like to do? And then what we attempt to do, we evaluate your range of motion, strength, joint mobility, flexibility, and we outline a progression. Sometimes we won't actually give it to you in hand, but at least we have it in our heads where we can start progressing you through a program while you're at therapy. And once, again, that's just the initial stage of it. You're not going to be coming to therapy for 5 to 6 years, anything like that. It's more of a finding out what's wrong, finding out what we need to fix it. We'll be guiding you through it and then sending you on to independently progress on your own, which is kind of where this talk picks up is kind of afterwards, starting on your own type of therapy. We need to refocus some unrealistic goals. I mean, sometimes there's just things that we aren't able to do, and that's okay. I mean, it's not someone that comes in that just had bilateral knee replacements and they want to say, hey, I want to go run a marathon next month. It's just, that's not something that we're going to be able to do. And that's something we really, I don't like saying we're not going to be able to reach this goal, but how about we back it up and say, well, why don't we go backing up, maybe let's walk a mile in a month. Something like that is really making sure that we can get that to a realistic goal. Patient education, avoiding injuries. We don't do it a ton, but I think it's a big point, which maybe something in the future we could look to doing is talking about nutrition. I think plays a really big goal is what we put into this machine, which is essentially what we are. I mean, you don't put the right fuel in your car, it doesn't go anywhere, right? So nutrition, that could possibly be something for a future talk I think would be pretty interesting. So I might have just roped myself into doing something there, I don't know. I should just read what's on the slides, Justin. Okay. Again, taking a past medical history is great. Number one, key importance, finding out current and past illnesses. Some of the exercises and stuff we need to know what's happened in the past, previous injuries. A lot of times people are coming in with knee pain, and that's one of the main things that they're complaining about. But the problem was 6 months ago, they had a rupture of a tendon in their foot that was misdiagnosed, undiagnosed. I mean, everything starts from the ground and works its way up. So really it's finding the kinetic chain from the ground up and figuring out really where the main key problem is. Let's see. Assessing our function, again, we talked about that, your cardiovascular and your musculoskeletal strength system, seeing where they're at and what things need to be evaluated. Getting into the meat of the presentation, exercise prescription, once we've done our evaluation, figured out what things the problems are, what things need to be looked at and improved upon, we break it down into 5 key areas. We talk about the mode of activity, what type of mode or what the actual activity is itself that we want to start initiating. Next is the intensity, actually where to start baseline and work our way up as far as the intensity goes of the exercise. The duration, how long we're going to be doing the exercise, frequency, how many times either per day or per week, and then the rate of progression, how to go from day 1 to month 6. Where are we going in between there? So again, mode. Starting out with exercise, it's important to note that you don't really want to focus on one specific group beginning an exercise program. You want to work on the large body of the muscles itself. Focus on activity that uses large muscles and can be maintained for longer periods of time in rhythmic nature. Walking is a great example of that. Most exercise prescriptions, again, are to increase or maintain your functional capacity that you're at right now. So as far as increasing your capacity, earlier on, you want to begin obviously increasing from baseline, and then as you get up to the top, there's a certain percentage of where we have to, there's a ceiling in everyone's exercise routine. There's a ceiling unless you're taking some other, they call it performance-enhancing drugs. You guys have seen that on SportsCenter, I'm sure, of going above and beyond what your body's natural ability is. You can see there's a guy that probably took one too many steroids in his day right in there. So aerobic exercise. Someone give me an example of an aerobic exercise. What would you consider an aerobic exercise? Anybody? Running, jogging, walking, anything that you have that requires utilizing your, I would say, longer periods of time, greater than probably 20 to 30 minutes. Whereas it's not a sprint, it's more of like our marathon. So it's a longer period of time, whereas a sprint is more of an anaerobic. So there's 2 different sides there, using 2 different types of muscles. So first off, this is again going back to that third slide, talking about the guidelines from ACSM. They recommend accumulating at least 30 minutes a day for 3 to 5 days a week. So it doesn't have to be continuously 30 minutes. If you have 10 minutes here, if you have 10 minute break, you can go out, walk the halls 10 minutes. That counts for 1/3 of your 30 minutes. doesn't have to be consecutive. So you don't have to go out and say, oh, dang, I only have 30 minutes in between my shows. I have to get out there and do it. You don't have to do that. You can do it during the commercial breaks. Do 2 minutes here, 2 minutes here, 2 minutes here. They've shown that actually the intermittent activities still have the same benefits as the continuous exercises, which I thought is a pretty neat thing to really wrap your head around on that one. 3 to 5 days a week. I usually just tell my patients most days of the week, which means there's 7 days a week, four times a week is plenty. Looking at the intensity of the exercises, has anyone figured out their maximum heart rate? Does anyone know how to do that? We got 1, 2, 3, 4. Okay. Anyway, it's a pretty simple equation. We take the number 220 minus your age. Let's calculate it real quick. Everyone just write down their maximum heart rate real fast. So 220 minus your age. That's our estimated maximum heart rate. Got it? Now we have to do a little math besides subtraction. I'm going to need somebody's calculator. Do you have a calculator in the front row, anybody? Let's do an example. Anybody have a calculator? I can get one. I'll get one. So, example, what was yours? What was your 170? Okay, so the range we want to exercise as far as our heart rate is 220 minus your age, which equals, you said it was 170, okay? So 170, the range we want to be in is between 50 and 85% of that 170. Okay, so we want to do 170 times 0.5. All right, so we want to start out, our low end is going to be 85 beats per minute. Does everyone know how to find their heart rate? 2 fingers, radial pulse, right here. You can do here or here, carotid. Now, don't use your thumb. Why? Yes, it does. So you're going to get a double pulse. But you don't want that. That's too much. All right, so we got low end of yours was 85 beats per minute. That's where we want to start. That's our baseline for exercise. Okay? Does everyone get how to do that? You don't need to go out and buy these fancy heart rate monitors that cost $150 that you put across your chest. This is my $250. You don't need that. Just use your finger. Use your radial pulse. It's easy. To the upward end, again, intensity of 85%. So we'll do that 170. So 144 and a half. So you want to be between 85 and 144 and a half for our target heart rate in between there while we're exercising. And again, I'm going to get into what that low end and what the high end mean, of what you want to focus on for the low end and the high end, what benefits your body is. We good on that? Okay. Yeah.
Is that dependent at all on your resting heart rate?
No, it's again, that's just, oh, sorry. The question was, does that depend at all on your resting heart rate? This is a generalized number, the 220, and it's just based on your age. It rounds up, rounds down. It's about average of your maximum heart rate. If they would put you on an exercise treadmill and they would actually calibrate and test your maximum heart rate, it would probably be within 5 to 10 beats of what your actual maximum heart rate is. That's a good question, though. It's pretty, yeah. I say within 5 to 10 beats, they've done the testing on that, so it's pretty accurate. He asked if the testing is pretty accurate compared to just doing the number and actually doing an exercise test to actually get your maximum heart rate. It's pretty close. And again, this is normal, healthy. If you have heart conditions, things like that, that's a whole other ballgame. You're dealing with beta blockers, alpha blockers, things like that. That's another question for your doctor, and a whole another presentation on exercising with cardiac patients, which I probably just wrote myself into another presentation. Well, exactly. 20 to 60 minutes overall. Usually, again, we're trying to accumulate that 30 minutes. You can go from the beginning, starting out with exercise, starting at 20 minutes and working your way up. I'm going to go into more of really what you can really start doing, how long to do it at a later slide. Again, we talked about that aerobic exercise, jogging. Someone said running, biking. All these down and through here are good examples. When you go into the gym, if you're going to start an exercise program, who is getting ready or is already doing an exercise program regularly, 3 to 4 days a week? Good. Who is going to start, wants to start, doesn't know how to start? Don't be shy. Okay, it's fine. Who's here for the free cookies and water? That's what I'm here for. If you're signing up, I know this is probably a good talk to give probably the first of the year because everyone gets those gym memberships as their Christmas gifts. When you go into a gym, get a tour, have the trainer show the exercises to you, have them show how to use the equipment. That's the big thing. I see people get on these equipment and I'm like, I don't know where they saw that on YouTube, but that's not the way you're supposed to use that exercise machine. Absolutely. Yeah, I would say if they had like a silver sneakers kind of thing, like that's an awesome program. I think that's great.
I have a question.
Yeah.
How can you be assured they know what they're doing?
That's another great question. I'd say, where's that little certificate hanging up on the wall of some sort of training? Of some sort of training. They should have some documentation that they've done either just a basic personal training course, strength and conditioning, anything like that. I wouldn't just take some guy's recommendation that doesn't know what he's talking about. That's the big thing too.
Do you have to sweat for it to be considered aerobic?
I'm going to get into that too, but yeah, you want to be breaking a sweat of some sort. Again, that's normally, yeah, you want to be breaking a sweat.
Wouldn't that be hard to do on an intermittent basis?
Well, yeah. Well, I'm saying as far as aerobic goes, if we're going for getting in this upper end of the 85%, it would be tough. And that's why we want to make sure if we're doing, I sweat as it is, but if you go in there, I can get sweaty in 10 minutes by just walking around. And people are individual. They do it on their own pace. That's a good question. I didn't repeat that one, probably. Oh well. We're still good though, everyone. Any other questions as we go along? 3 stages of the training. Again, we're still talking about the aerobic training. There's the initial stage, and I think this is where I'm going to get into your question about having to sweat or anything like that if it's intermittent. There's different stages. There's the initial stage, the improvement stage, and the maintenance stage. And this is going to get into our different heart rate extremes. So we talked about his 50% heart rate is where we want to start out at, getting up to the 85%. If I'm going at 85% of my